Hello dear friends, I am Dr. Hosseini and welcome to Medical and Health. Salt, also known as sodium chloride, is about 40% sodium and 60% chloride. The human body requires a small amount of sodium to conduct nerve impulses, contract and relax muscles, and maintain the proper balance of water and minerals. Eating too much salt can contribute to high blood pressure, which is linked to conditions like heart failure and heart attack, kidney problems, fluid retention, stroke, and osteoporosis. You might think this should mean you need to cut out salt completely, but salt is actually an important nutrient for the human body. Your body uses salt to balance fluids in the blood and maintain healthy blood pressure, and is also essential for nerve and muscle function. Consuming a small amount of salt during diarrhea and vomiting or during intense physical activity in hot weather compensates for the lost solutes in the body. So while a little salt in your diet is necessary, it's important to keep the amount in check. The World Health Organization recommends adults eat no more than 5 grams of salt a day, which is less than 1 teaspoon. Unfortunately, the average people is consuming double the recommended amount of salt. To help you track how much salt you are eating, you can find out how much salt is in packaged foods by looking at the food label for the sodium level. Try to aim for items that have less than 120 mg of sodium per 100 grams of the food. You should aim for a maximum of 2000 mg of sodium a day. Salt helps to balance blood sugar, so part of the treatment plan for diabetic patients is to regulate their salt intake. Salt helps to soften and smooth the larynx and prevents mucus from becoming sticky, which is seen in shortness of breath. Helps absorb nutrients in food. It plays a role in regulating sleep. Effective on dry mouth and dry cough. It's effective for colds and sinusitis. Salt is considered a natural antihistamine and is useful for allergies, prevents muscle cramps, improves the function of nerve cells. The fact is that salt is necessary for the body in a normal amount, about 5 grams per day in adults, and a small or large amount of it both causes complications in the body. Salt causes an increase in blood pressure, and its deficiency also causes a decrease in blood pressure and the difficulty of blood transfer by the heart to some organs. Salt deficiency causes muscle cramps, especially during exercise, which can be extremely important for athletes. Eating too much salt is an effective factor in high blood pressure. As mentioned, high salt consumption is one of the major public health challenges in the world and is one of the contributing factors in high blood pressure. It has been reported that excessive salt intake may be responsible for almost half of the disease attributed to high blood pressure and is associated with kidney disease, increased risk of obesity, osteoporosis, kidney stones, and stomach cancer. Salt keeps water in the body, and when its amount increases and a lot of water remains in the body and blood, this high blood pressure that has been created can cause pain in some organs and even serious damage to the capillaries. Too much salt in the body also puts pressure on the kidneys and brain. It causes a heart attack and a stroke. In addition to the mentioned cases, too much salt takes calcium from the blood and removes it from the body with urine, which causes osteoporosis. Thanks for watching. Please tap the like button to support me, and also don't forget to subscribe me for more medical and health contents.